talked a little bit about having a demonstration, and he very kindly said that he'd get his mates to come down and put a demonstration on. So we got Martin and Kieran who were down here. So as I explained before we started the first session, we have had 3 incidents where we had to call upon the defibrillator. And at the time we've been fortunate that we've had 1 or 2 people that have stepped forward to actually take charge while it happens. A couple of things we've got to do. First thing is, somebody's got to take charge and call 999. Get a call in immediately to say that something has happened. Explain who's gone down and explain where we are. That's not as easy as it works out. We are off Homefield Lane, Unit 2, Biz Space, WF27AZ. Now, we then generally send somebody out to stand on the main road because the first time it happened, the ambulance drove past. They were looking because the postcode covers a wide area. So that's the first thing we do. We call 999, we send somebody outside to make sure we get the responders in. Somebody then also runs to get the defibrillator, which is in the office. We have it in the office because it's a little bit unsafe with some of the people who play down here to leave it out here. Anybody who comes on a Thursday night knows exactly what I mean. And then the third thing is somebody takes charge and starts performing CPR. And the lads are just about to go through and give us a little bit of a demonstration. I'll leave it to you for your expertise, if I may, Martin.
Right, so this is the one that you've got down here, which is an iPad one.
Sorry to interrupt. Now, can I just make a suggestion? What about people videoing? You know, then they've got it, I think you can remember it. Oh, it's videoing. No, shut up. Sorry.
Yeah, he'll send it round to go.
Sorry, Mark.
It's fine.
Enough trouble as it is.
Yeah.
Thanks. Good then, Mark.
Yeah.
Found his vocation in life at
Yeah,
last.
you can understand me, I'm from Barnsley anyway, so you might not understand me.
I understand you then.
Right, so, yeah, so
Okay.
what you've got is, you've got the iPad one, okay. The one that I'm going to show you today, obviously we can't use this for the demo because it's a live one. The one that I've got is just a training model, but it gives you the same kind of instructions, tells you what to do, and we can work through it, okay. So this iPad one, the pads are actually in the back of the machine, and you just pull those out, turn the machine on and follow the instructions, okay. But I'll show you how it works with our one. So let's just imagine then that someone's collapsed on the pitch, yeah, they're fallen unconscious for whatever reason. We don't know whether it's an heart attack or whether they've gone into cardiac arrest or what, so we need to find out to make sure that they are in cardiac, whether they're in cardiac arrest or whether they're just unconscious. So the first thing I'm going to do is I'm going to get down next to him, yeah, and I'm going to say, "Can you hear me, mate?" Yeah, and try and get a response from my casualty. "Can you hear me?" Yeah, he's not responding to me, he's not responding to Cashin, he's not responding to his voice. So I'm going to send someone to go and get the defib anyway, because it doesn't hurt to have it here, even if we're not going to use it. But if we do need to use it, it's there then, innit? Yeah, so defib's on its way. Okay. Now then, next thing I need to do is check inside his mouth, because he might have thrown up inside his mouth. And we don't want to open his airway and that sick go into his airway and compromise his airway. So I'll have a look inside his mouth, that's clear. So now I need to open his airway to see if he's breathing. So to open somebody's airway, put your fingers under the chin and hand on the forehead, tilt it back, yeah, that opens his airway. And then I'm going to check, see if he's breathing. So I'm going to look, listen and feel for about 10 seconds.
You're looking for the chest going up and down.
Yeah. I'm looking for rise and fall at chest. I'm listening for breath in my ear, feeling for breath on my cheek. And I might put my hand on the diaphragm there, see if I can feel any kind of movement. Okay? I'm not getting any breaths on this occasion. If they are breathing, that's fine. We can just look after them, talk to them, yeah? Obviously, ambulance is going to be on its way, and we'll let them know that we've got an unconscious but breathing casualty. If they're not breathing, we don't need to bother checking for a pulse. If he ain't breathing, he's in cardiac arrest. Okay. So, when we get on the phone to the ambulance service, let them know that your casualty's not breathing. That will let them know that you've got someone in cardiac arrest, and you'll get an ambulance quicker than anywhere else. So if someone's, for example, broken the rib somewhere, ambulance is winging its way to them. When you phone up and say, "My casualty's not breathing," they'll know that you've got a cardiac arrest, and that ambulance will come to you instead. Okay, because the ambulance service, at least in Yorkshire, are working at about 80% capacity at quiet times, and above 100% capacity at busy times. On Friday night, when everybody's eating that, yeah, there's no ambulances. Yeah, they're just parked at the hospital. Okay, so mine's unconscious and not breathing, so I know he's in cardiac arrest. So I'm going to say to somebody, defib's on its way already. I'm going to say, Down 999, ask for an ambulance, tell them that I've got a non-breathing casualty, then they know we've got a cardiac arrest and they're going to be coming quicker. Okay. Now, I'm going to clear it, I'm going to bare his chest because we can't put a defib on over clothing, it's got to be on the bare chest. For ladies, you're going to have to cut the bra off or get the bra off to put a defib in place.
No, I think it'd be a good idea to have scissors.
Yeah, scissors and stuff like that, yeah.
To open up.
Yeah. So obviously this one, I'm going to have to pull it over his head. In reality, I get some shears or some scissors and just cut through like that. Yeah. So I get that off. Yeah. And his chest bare. Now then, somebody's gone to get the defib, but I'm going to start doing chest compressions. Doing chest compressions will pump oxygenated blood to his brain and keep his brain alive. Because the brain needs to be alive for the defib to work. Okay. So I start doing compression, so to find middle of chest, yeah, right between nipples, directly between nipples, yeah, heel of your hand on there, hand on top, interlace them, yeah, get over the top, and we're going to start doing compressions.
This is where you have to give it like some light good force.
Yeah, you want to be going down about a third of the depth of the casualty.
Takes some doing, doesn't it?
Yeah.
Don't you break ribs sometimes?
Yeah, you probably will do, yeah. Especially if you've got older ladies who've gone through menopause, they start to get osteoporosis, which is brittle bones. So on older ladies, you'll definitely break. And on blokes, you will sometimes break ribs as well. Okay. On youngsters, they're a bit bendy, the bones are a bit bendy, but you still might break bones. But we're only going down a third. So obviously, a third of Kempez is different to a third of me, isn't it? Yeah, little Mrs. Figgins is different to a third of Dwayne the Rock Johnson, yeah. So you're looking at the depth of the casualty and going down about a third. Okay. Now then, once I've done 30 compressions, if it's my best mate, yeah, I'm not going to be scared to get my gob onto his gob. Okay. If it's someone that I don't know, I ain't going to count to 30. I'm just going to keep doing compressions. Okay. The theory is, when I'm pressing down on his chest, I'm deflating his lungs slightly. When I release and the ribs spring back to the normal position, yeah, that's going to draw air into the casualty, so some air is going to be going in. However, casualties that have been breathed into, had ventilations, have a 25% higher survival rate than casualties who've just been hands on the CPR. Okay, so hands on the CPR, if you don't know them, if it's your partner or whatever at home, yeah, or your best mate, and you feel comfortable putting your mouth directly on theirs, do it. If not, if you can get CPR masks or face coverings, yeah, then you can put breaths in. So put that over the nose and mouth, yeah, go like that. 2 breaths into casualty. Then back to compressions. Otherwise, if you haven't got one of them, just keep doing compressions. Right, somebody turns up with the defib. As soon as defib turns up, stop doing compressions and get that onto them. Okay, so first thing I'm going to do, turn it on. Get me pads. Get them out of the
Apply
packet.
pads to patient's bare chest. Plug in pads connector next to flashing light.
So it's telling me to plug it in. Yours are already plugged in, so you won't get that prompt. But I'm going to put the pads on. Now,
Apply pads, plug in connector.
so I'll just pause that a moment, because he'll keep talking to me and getting on my nerves. Right, so on these pads, yeah, there's a picture of where to place the pads. Yeah, one goes up near the clavicle, yeah, top of the chest, and one on the side. Okay, so I peel it off, that one there, look, shows me where to put it. I peel it off, and I stick it on the clavicle. There it goes. Make sure it's connected. This one, I peel it off and I stick it on the side. And then when the defib shocks him, it'll go directly through the heart and shock the heart back into a normal rhythm.
Does it matter which side you put those on?
No, some of them tells you.
Yeah.
Other ones, the polarity doesn't matter, you can put it either side. Okay, but this one says, put one there and one there. Okay, once they're in position, I'll pause that. I place that in there.
Analyzing heart rhythm.
Straight away it goes into analysis. It's analysing the rhythm.
Touch the patient.
So did you hear it say, don't touch the patient? If I touch the patient while it's analysing, it'll pick me up as signs of life and it won't shock. it'll think that he's got a normal heart rhythm because I've moved him. So if I keep my hands off him, it's doing its analysis.
Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
So it said shock delivered, begin CPR. Now then, it's telling me to start CPR, but his heart might have restarted. Okay. If the heart's restarted, he's normally going to start showing signs of life. So his heart started, and blood is going to start coming back into the surface of his skin. You'll see colour come back to him. You'll see him normally breathing, normal rise and fall of the chest, blinking, swallowing, all that other stuff. Okay. If that happens, you can turn the defib off, but leave the pads in place just in case he goes back into cardiac arrest again. Okay. Then you can talk to your casualty and look after him. Yeah. Yeah, ambulance on its way, mate. Don't worry. Keep him warm. Yeah, talk to him, reassure him. Yeah, wait for the ambulance to arrive. If not, if it hasn't worked, then we're going to start doing CPR. Okay, so straight back onto CPR, and we start doing CPR, and we'll do CPR for exactly 2 minutes. Okay, so I'm doing CPR for 2 minutes. If I want to put breaths in, I'll do 30 compressions and 2 breaths. If not, I'll just keep doing this for the full 2 minutes, which is quite tiring. Okay, I might get someone to come and take over from me. Okay, now then, after 2 minutes, it'll go back into another analysis.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Press the orange button now. Shock delivered. Begin CPR.
So he said begin CPR, but on this occasion, we'll imagine that our casualties now start showing signs of life. Yeah, start showing signs of life. Talk to them, reassure them, keep them warm, wait for the ambulance service to turn up. It's as simple as that. Just follow the instructions and look at what your casualty's doing. Yeah, if they're not doing anything, keep doing CPR and keep shocking. It's as simple as that.
Once he's breathing, you put him in the recovery.
You can put him in recovery position, but that's no longer routine. It used to be routine to put people in recovery position. Yeah, but if he's happy breathing on his back, yeah, him or her, yeah, leave him on the back and just look after him. If they start to vomit, then we'll recovery position them. Yeah, just get them on the side, yeah, to let the vomit drain away. Then we can put them back on the back again if you're happy. Everybody happy with that?
Yeah.
So that's how we use it. Yeah, it's that simple.
The good thing is, Niall's already got things in place. Like if someone goes down, Niall's already getting someone to go get it. He's already getting someone for ambulance spotter.
Yeah.
He's already getting, he's got things in place. And out of the 40 of you, there might be a good 10, 20 of you who might think, oh no, this isn't for me. If it is, just get away. And there'll be 2 or 3 that will step up and do it naturally. It's human nature that someone will come and help. But don't be afraid if you're not one of them, as long as there's at least 2 or 3 of you. Because if you went down, you'd be like that, God, please someone do something. So you just got to think about that. It's always better to do something than nothing. So just try and do it.
Now then, this defib is simpler than that one, because this one, I've got to press the button. This one here is an automatic shock one. So there's no button to press. If it senses that he needs a shock, it'll say, shock advised, stand clear, and it'll shock the casualty. But be careful, if you're touching the casualty when it shocks, you'll get a shock, and that can put you into fibrillation. Yeah, so you end up like
It's probably fair to say that when John Mack, who was there, had his heart attack, I think stood here,
Yeah.
and he bounced, and he must have come up to about here.
Oh, yeah,
and
yeah.
it does bang you. It does.
the shock
come with
coming
a
through
shock.
the body, yeah. But if you're touching them, you'll get that shock. Yeah, it starts off at 40 joules and it works its way back to what joules are, where that stands on voltage or ampage. But it's not good for you. Yeah, it's shocking your heart out of fibrillation, which is like a wiggly line, into your normal sinus, what's known as sinus rhythm, your normal heart rate.
Can I ask, you mentioned cardiac arrest and heart attack.
Yeah.
Are they two different things?
So an heart attack causes cardiac arrest. Okay, so it's not always an heart attack that causes the cardiac arrest. You've seen these younger footballers, Ericsson and that Bobamba are the most famous cases where they just collapsed on the pitch. Yeah, it's just an unknown phenomenon in like athletic people or people who keep themselves relatively fit, where their heart just goes haywire and they go into fibrillation. Okay, so they'll start off in tachycardia where the heart speeds up really fast. Then you think, well, surely that's pumping more blood around, but what happens is because it's pumping so fast, the heart doesn't refill with blood. They get a drop in arterial blood pressure and they fall unconscious and they go into fibrillation. So that's what causes it. Yeah. They don't know why it happens to footballers and fit people and karate experts and all that kind of stuff.
Trained athletes like
Athletes,
us.
Is everybody happy with that?
I've got a question which is quite.
Yes,
we're
mate.
all of. Some of us are more senior than others.
Yeah.
Some of us have pacemakers.
Yes. If you've got a pacemaker in, yeah, is it on this side?
I haven't got one in, but I know some people have.
So normally pacemakers are under the clavicle, so you'll see the pacemaker. Yeah. Make sure the pacemaker, the pad isn't touching the pacemaker. Okay. It's on the opposite side. However, if that one stops working, they don't take it out. They'll just put another one in. So you might get a pacemaker on this side.
Right.
Yeah. If so, just make sure the pad's a bit lower.
Call emergency medical services now.
So that's the real one talking.
Shutting down.
I take it they're all verbal.
Yeah, they all talk to you, tell you what to do. Different voices. So I've got one at home that's American. It's got like an American voice. The one that we've got, yeah. The one we've got on Fire Engine talks like a Pathé newsreader. Yeah, this one talks like Buffalo Bill from Silence of the Lambs. So you know, but just make sure that your pad isn't touching. If there is a pacemaker on this side, make sure the pad's not touching it. Yeah. Nipple rings, chains, make sure they're not touching because they'll burn. The shock goes through that and it burns. Yeah, try and avoid it if you can.
Yes.
But I'd rather have a burnt nipple than be alive than be a pristine corpse. Everybody happy with that?
Yeah. Just on another point, been speaking to John, he's got a defib already fitted inside, so in that case,
No, that was
you don't
Johnny.
need that, so just kind of be aware who you're with and what they've got.
Yeah.
You mentioned about location. Do ambulance services use what 3 words?
Yeah, they will do. Yeah, so if you've got what 3 words, use that. Yeah, definitely. And we use that.
Yeah, you've got it in there.
Another thing as well. You've got on this one. You've got different. Yeah, you've got different settings on there, so you can change the setting on that to child. If you've got anyone under the age of 18, yeah, that's classed as a child. This one says 1 to 8 years old.
Yeah.
So anyone 1 to 8 years old, you change that setting, and then you place the pads front and back. So I've got some paediatric pads for mine. Yeah, and the paediatric pads will normally, on this one, use the same pads. On this one, you've got separate pads, and the plug is normally pink, and it has a picture of a child on the front. And as you can see, it shows you where to place it on the front and on the back. Okay, but that's only for children 1 to 8.
Did you have different amounts of compressions?
Yeah, so same amount of compressions on the child. Yeah, but obviously, if it's a smaller child, just one hand, and if it's a baby, just 2 fingers in the middle of the chest. Anyone like 1 year old, up to 1 year old. Happy with that? Yeah. Lovely.
Thank you to everyone for coming down to stop it. Thank you. 6 hours every month, and we'll have a look at getting some of those. I thought we've got some actually, those little face masks. Little face masks that we'll have a look at. Right, we'll have a look at it. But again, thank you very much for stopping. It's useful for emergency notice. Yeah.
Yeah, I've got defibrillator fitted.
Right, okay. So what advice has the ambulance service given you or the hospital given you?
Hey, you stopped playing 10 years ago, man.
Yeah, so normally if it's got an internal defib, it's a bit like a pacemaker. Obviously, we're going to put our defib on because that one's obviously not working, is it? I'd just put it on.
It's just like it's
Yeah. But if yours has stopped working, that's why you would have. If your defib stopped working,
Yeah, it should have kicked in.
If that should have kicked in. If it's not, then I'd put this one on.
That means Rocky can go on forever.
Again, thank you to the three fellas who come down.